Good afternoon. I'm Jennifer Bender, Public Information Officer with the Watertown Area COVID-19 Task Force. Thank you for joining us today. We have a great lineup of speakers, and up first we have Mayor Caron.
Good afternoon. Today is Thursday, August 27th, 2020. In South Dakota, there are currently 75 people hospitalized with COVID, and we've had 162 deaths. In Cottington County, the number of cases jumped up to 243 with 169 recovered, which means we have 74 active in our county, which is a new high. There are currently 155 active in our 9-county region, and that also is a new high. Now, that sounds really bad. There were some glitches with the way that the state was reporting the numbers, so it really hasn't jumped up that dramatically, and we're not sure when those cases occurred. So we don't think that that just happened overnight. They are high numbers, but the good news is that currently no one is hospitalized at Prairie Lakes Healthcare System with COVID. So we do have this under control at the moment, but we are getting lots of calls. We're seeing that the schools are getting lots of calls, and the healthcare providers are getting lots of calls as well. We would like to urge everyone to utilize the 211 hotline, and Jennifer Bender will be talking a little bit about that in a few minutes. Everyone is just really getting tired of COVID, though. The fatigue has gotten all of us, but now is not the time to relax. We need to continue to do the good practices that we all know. We need to wear a mask when we're in a group, and if we can't maintain a good 6-foot social distance, don't visit crowded places. If you can avoid it, keep that physical distance whenever possible, at least 6 feet, and continue to do hand washing and stay home, of course, if you're sick. And if we continue to do those things, we should be able to maintain control. We need to continue to make responsible decisions. So now I'll let Jennifer Bender from Prairie Lakes Healthcare System speak.
Thank you, Mayor. So if you do have COVID-19 symptoms, there's a few things that you should know to do. The first thing you need to do is stay home. And when you are staying home, you need to call your healthcare provider. So that could be Brown Clinic, Sanford Clinic, Quick Care, Garcia Family Clinic. You just need to stay home if you have COVID-19 symptoms and call your provider and ask if they think you should be tested and what to do next. Now, what if you've been exposed to someone who is positive for COVID-19? Well, according to the Department of Health, you need to self-quarantine, so stay home, and monitor for symptoms. And they recommend quarantine for 14 days. Now, there's a lot of questionable things that could happen. So let's pretend you go to a wedding. You go to a wedding for a family member and someone there tests positive for COVID. Or let's say you have a family member and they were in close contact with someone who tests positive for COVID, right? This raises a lot of questions. So what do? Well, this is a great time to contact 211. So last February, if you all remember, we teamed up with 211 so all residents in Cottington County could call to ask for resources and for help. So you can call 211 or you can text your zip code to 898-211 and they can help you find resources or refer you to the right agency or organization to get what you need. So this is very important. If you have any questions about COVID or concerns, they can help refer you correctly. Now, if you do, again, have symptoms, don't call 211. Just go ahead and call your healthcare provider if you have those symptoms. Thank you. Up next, we have Kelly with the Boys and Girls Club of Watertown.
Thank you, Jennifer. Today, I would just like to update the community on our fall programming and what we are doing for kiddos after school. Typically, this is a time where we are very excited to open up our doors for kids after school. And in our current situation, we are, however, the numbers will be very much limited to what we're used to. So under our current circumstance, we are increasing what we have been able to serve at the club, but we are keeping groups to about 20 to 25 youth per staff member. And those groups will stay consistent as the children attend the club, and they will stay with that staff member. They will then rotate to different areas each day of the week. So if they're in the gym one day, they'll go to the education center the next, and so on, moving around the club throughout the week. Our hours have changed a little bit as well to provide for extra time for our staff to clean and prepare for the next day. And so our after-school hours are 3:30 to 6:30 p.m. In order to be eligible for this program, kids did have to be signed up ahead of time, and we do have a wait list available. And if you would still like to sign up for that, you can do so and find that on our website, which is bgcofwatertown.com. We really hope to serve older youth members, so right now our program is only open to first through fourth graders. And we really hope to serve those older youth members at a later date in some capacity, and we will certainly communicate that news out to the community on our website and social media channels as well. So if you don't follow us already, make sure that you do. We will continue to provide our GIFT program, which is our free homework assistance program. And that takes place at McKinley, Millette, Roosevelt, the Watertown Intermediate School, and the Watertown Middle School. And that program begins on September 7th. And so that's a good alternative for kids, not only to get homework help, but also to have some sort of after-school programming if we are not able to serve them at the club main site. And in order to sign up for that program, you can talk to your child's teacher. I think that's all I have. So Deb from HSA is next.
So today for Watertown was the first day of school. And usually the first day of school brings a lot of excitement and anxiousness. And while today is no exception, it is different. As a parent or caregiver, we have a lot of questions and concerns. Will my child have a good day? Are they safe? Are they going to be able to focus and learn? Will they get sick? Will others be kind to them? Will the school stay open? What about my own job? As a teacher, there are a lot of questions and concerns. What's the school year going to be like? Is my classroom safe? Will the students be able to handle the changes? Will I get sick? What if my students get sick? What happens if my own kids get sick? Can my students focus and learn in this environment? How are parents going to react to these things? Will school stay open? As a student, we have questions and concerns. What will school be like? Will my teacher be nice to me? Will I get sick? Will my family or friends get sick? Will my friends still like me? Will school be too hard? What about recess or PE? Because those are favorites. What about my lunch? Can I use the bathroom? Will other kids make fun of me because I'm wearing a mask or not wearing a mask? What if I make a mistake? Is school going to stay open? Who's going to take care of me? And as a clinician, we have questions and concerns. How are parents and caregivers doing? How are students doing? How is the school staff doing? How are the kids, parents, and teachers going to handle this school year? How can we increase our reach and our awareness in the mental health of others? How can we prepare, support, and communicate to create a safe space for everyone to be able to process all of these worries and emotions? Well, when we know more, we can do more, so please keep communicating. I wish we had the answers, and sometimes we don't. I wish we knew the future, and right now, and ever, we really don't. We can't fix everything. As students, parents, or caregivers, teachers, clinicians, community members, we don't do well with the unknown. We don't do well when we can't control things around us and our experiences. We like to fix things. We're in a state of unknown and we really don't know how to fix that. And this creates stress, frustration, fear, panic, and other powerful emotions. So what can we do? We can focus on what we do know and what we ourselves can control. No one person can fix this situation. We can't control others. And the most powerful thing we can do right now is to come together as a family, as a school, as a community, and work together to help the situation. We as a community can do the best we can to support one another during the school year. It takes a village. We can check in with one another, we can volunteer, we can show kindness and tolerance. We can wear a mask, we can wash our hands, and we can practice our self-care. Awareness matters. Our kids aren't always able to tell us when they're struggling. They do try. Their little minds and their big hearts aren't built to cope with such extreme stress and emotion. We often don't realize what they hear, what they feel, or what they notice. The saying, children are like a sponge, is accurate. They learn from us, parents, teachers, and friends. We think we can hide our fear, concern, anger, or whatever emotions we're having, but we really can't. Our kids notice us. Maybe we don't talk as much as we used to, or we aren't as patient as we were. Our conversations have changed, both verbal and nonverbal. The greatest thing we can do as a caregiver is to be aware. Do a self-check regularly. How am I feeling? Recognizing when you're stressed or having strong emotions. Using healthy coping skills, whatever those look like for you. Caring for ourselves is caring for others. Self-care is vital to our physical and mental health. If we leave one of those unchecked, the other will suffer. We want to be there for our kids. If we can't manage ourselves, it's time to get help. Reach out to a mental health professional because we are here for you. Have grace with your kids and teachers. They're doing the best that they can with the unknown. Communicate openly and be aware of your words. Our kids communicate through behavior. If you're noticing they're tired often, or maybe they aren't as patient as they used to, eating more or less than they usually do, don't enjoy usual activities, avoiding others, difficulty with sleep, they're nervous or restless, you noticing complaints of stomach aches or headaches, or other externalizing behavior like lashing out, are signs to watch for. Start checking in now, don't wait for the problem to develop. Avoid watching gloom and doom news programs, especially when kids are present. Model kindness, grace, and patience. When they arrive home from school, have some wind down time and time to decompress because they have had a long day. If you notice continued struggle, reach out to a mental health professional. We're here for you and kids. You matter. Teachers should also be aware. Your students are carrying big worries. You have a large class of students and it's tough to check in with everyone. You do what you can when you can. Watch for those same warning signs. Those can be different for every child, and with these students being new to you, you aren't always aware of what those are going to be for each kid, and that's a challenge. Watch for those same externalizing behaviors, talking out of turn, refusing to follow instructions, restlessness, chewing on their fingers or pencils, making fun of others or lashing out, and also be aware of those internalizing ones. They're quiet. They're not expressing facial expressions, isolating themselves, they can't focus, or they appear fearful. Do your own self-checks regularly and stay hydrated. Before class begins, during breaks, and after class, rehydrate. Practice your self-care and healthy coping skills. You just handled a lot. Care for your family, and if you're ill, stay home and get well. Keep things positive, upbeat. This will not only help your students, but also yourself. We do appreciate and value you. You're on an expedition to unknown teaching territory. Thank you for your courage. Show grace with students and parents. They're doing the best that they can as well. Communicate openly and be aware of your words. If you're struggling, reach out to us. We're here for you. To our students, we see you, we hear you, and we care about you. We know this is new and not what you expected. And I've been hearing that a lot. Please tell someone if you're having a hard time, no matter what the reason is. Your parents, your teachers, your school counselors, or maybe even your own counselor, we are here for you. Everyone is talking about scary things, and you see and have a lot of feelings. Please don't hide those. So what can you do to help? As a child, make healthy choices. Get plenty of rest, exercise, get fresh air, enjoy time with your family and friends. If you're within 6 feet of others, put a mask on and wash your hands often. Do your best not to touch your face or put your hands in your mouth. Be kind to others. Respect their space and their choices. Your teacher and parents are doing the best they can to keep you safe. If you're having a tough time, tell someone. You don't have to do this by yourself. You matter. So what can we take away from this? Things are really tough right now. We have to work together to keep moving forward, and you can help the situation. You have things within your control, and we have to focus on those. Caring for ourselves is caring for others. We need to think before we speak. And if you're struggling, anyone out there struggling, please use available mental health resources. If you need some help, you can contact us at the Human Service Agency at 886-0123. This is also a 24-hour crisis line for emergency assistance after hours. We are here for you. We care. And you matter. Thank you.
I'm Kim Bellum from Mount Marty University, and I just wanted to share with you that our classes too started this week on the campus of LATC. And so our classes run from 3:30 to 9 p.m. in the evening, and we have about just close to 100 students who come to us from all over Northeast South Dakota. They're very excited to be starting back face-to-face classes. We're following all of the Lake Area Technical College's protocols since we do rent space on their campus. Our students are wearing masks in the public areas and social distancing in their classrooms, and if they cannot do that, of course, they're wearing masks. The classrooms are being sanitized all day long by Lake Area Technical College faculty, and we are also sanitizing the classrooms when we're done using them at 9 p.m. at night when we're done, and making sure that all of our students are following the protocols of washing their hands and using hand sanitizer and all those kinds of things. And so we are hoping that we can keep all of them safe. They're excited about being back. We currently, Mount Marty University in Yankton, and this also applies to our Watertown campus students, has partnered with Avera Health to provide testing for all of our students when needed. And there was an email that was sent out to all of our students to give them the process and the contact information if they feel like they're having symptoms or they need to be tested. And if they don't have insurance, that service is free of charge to them. So we're know that we are going down uncharted territory, but we feel like we can keep our students safe, and we are working with everyone here in the Watertown community who's been very, very good to work with, and we're so very thankful with the relationship that we have with Lake Area Technical College to work with them in this manner as well.
Good afternoon. I'm Steve Rehorst, one of the public information officers with the Watertown Area COVID Task Force. A couple things to mention to you before we turn it over to our media if they have any questions. First was, I think there's a lot of you out there that did what I did this morning, something we haven't done in probably about 5 months, and that's we woke up and we struggled to rush around and get the kids dressed and ready for school, make sure they're fed, and then leave and go back and pick up that one thing at the house that they forgot, and then leave again to go back to the school. And as I was driving to school, to the middle school today, I noticed something I haven't seen in a while, and that's a lot of traffic out there and a lot of kids riding bikes and walking. And as I drove up the hill on 14th Avenue and I came to the top and I saw the long line of cars that seemed like it was probably about 6-7 miles, maybe 8 miles long, I felt kind of this stress of, am I going to get my child there in time? And then I upset my daughter by, of course, letting a couple cars, probably 3 or 4, in ahead of me, and she was getting mad because she was going to be late. But in the end, what I found out was it actually doesn't take that long, and it goes fast, and the line moves really quickly. And so just a word of advice out there is you are getting going, and maybe you're not dropping kids off at the school, but you're driving through the traffic, take your time. Remember, the school zones are in effect 8 to 5 Monday through Friday unless it's marked otherwise. Be on the lookout for kids that aren't paying attention because they're excited to get back to school and they're going to run out in front of a car or something. So be driving slower, watch out for them, and then of course give yourself some extra time so you can drive back to your house and pick up that piece of homework they forgot and then get back on the road again. So take your time, slow down. It's been a long time since we've done this, so appreciate that. The other thing I have is I have an update from John Meyer, who's the superintendent of the Waverly-South Shore school there, and so I have just something I'm going to read from him. Things are going well at Waverly-South Shore. The year is off to a good start with both in-person learners and with students who have signed up for remote learning to begin the school year. Even though they're not requiring masks among staff and students, they're seeing a strong percentage of students choosing to wear masks, and almost all the staff are wearing masks throughout the school day. They're continually observing to see how the individual elements of the return to school plan actually function with staff and students in the building now, and they're very pleased with how everything has run thus far. Students are very grateful to be able to return to school, and the staff are very grateful to be able to see the students face to face again. They're incredibly grateful for the understanding and cooperation among students, staff, and parents with all the additional safety measures they are taking to help slow the spread of this virus. As the infection numbers continue to rise in Cottington County and in our state, they urge everyone to please make the responsible choices that will help to allow the school to continue holding school as normally. So please wear your masks, wash your hands regularly, and continue self-screening for possible COVID symptoms. Thank you very much. And that was from John Meyer, the superintendent with the Waverly-South Shore School there. So that's all that I have for now. So this time we'll turn it over to the media if there are any questions.
Question for Mayor Sarah Caron.
Go ahead.
Okay, Dan Chrysler from the Public Opinion. As you noted, as the data shows, cases are rising, not only in the state, but here in the county as well. Has the Department of Health, or are there any reasons necessarily like that the Department of Health is pinpointing for Cottington or the area around here as to the possible increase for? No,
It's not pinned to any one particular thing, and it didn't rise overnight. We're pretty sure about that. The reporting has probably just been increasing gradually.
Okay, thank you.
You're welcome.
All right, are there any other questions from the media? All right, if there are none, then we'll end the media briefing for today, and we are planning on holding these every Thursday at 3:00 p.m. For as long as needed. So we'll see everyone back here next Thursday at 3:00 p.m. Thank you.